So then you tell them.
I said, I don't want to make a decision until I see Dr. Choe or Dr. Giza.
So they left it up to you to make the decision. They weren't just going to shut you down.
They were going to shut me down if I didn't have a relationship. Or that was where it was heading for sure.
So they were like...
Because I've had this.
Okay, because you told them, why don't you let me go speak to UCLA BrainSPORT? I'm guessing they knew about UCLA BrainSPORT, right?
They knew through me.
They knew through you that you had seen them before for your concussions.
They've also been at, you guys have had
we've been
seminars in Pac-12.
We've been to Pac-12.
Yes.
Okay.
Sorry, that as well.
Okay.
Yeah, they've been.
So they're like, all right, go see them.
Correct.
And then they'll make the final call.
So we made an appointment, and they're like, okay, that's the day. We'll know then. But I actually went through and did the 8-hour neuropsych testing.
Right.
Went through all that, and then did I see you or Dr. Giza? I think I saw you both, actually.
I think probably you did see us both.
I think I saw you guys both.
Were you a fellow in the program at that time?
No.
Or you were
faculty.
You were faculty.
I'm really old.
No, you were not.
No, you're not. So someone comes to you and says, I've had several concussions. They want to, my sports med doc wants to retire me, right? And, that person happens to be a University of Oregon captain of the women's soccer team entering her senior year. What are some kind of things that you're considering and that you're factoring into making that decision? 'Cause that's a big decision, right?
So for me as a provider who takes care of a lot of athletes,
right,
it's never my decision. It has to be like, I will tell you what I think, and these are my recommendations, but it can't be I'm deciding. Otherwise, Sofia would have never come back to me if I were the kind of doctor who practiced in a paternalistic way and said, this is what you're doing.
Right.
She came back to us because she trusted us, because she knew that we make decisions together with our patients.
Right.
We can advise them and educate them and tell them what we think might be the best path forward. Once we get all the information, Sofia mentioned that she had the full neuropsych battery, the 8 hours testing, and that's one of the things that we look at. So we get as much objective data as we can. So the neuropsych testing helps us see where, a patient is cognitively. Right. And we didn't have like an 8-hour baseline test for Sofia, but she's a, senior in college. She's high achieving, not only on the field, but also academically. Yeah. So we have kind of an expectation and they can do kind of a look back at, these were her high school grades, that sort of thing.
Okay.
Neuropsych testing. We get imaging. So I think probably we got imaging for Sofia just to make sure on her MRI there aren't any signs that, there was some injury structurally that we didn't know about, but that could have been.
Did you do an MRI or did you do an MRI or did you do the DTI?
I did not do the DTI.
You didn't do DTI?
But I had a baseline MRI, I think like my freshman or sophomore year of
college.
Right,
because you've had head injuries in the past.
And then I had one that
and probably like, so we want to look at, a couple different sequences, but we're looking for any kind of signs of like small bleeds or things like that on an SWI. So, and so we would obtain that in the case of an athlete who was having this question about retirement. And the question it isn't always someone at Sofia's level or even beyond Sofia's level at the professional sport level. Even when we're looking at kids who may be, in junior high or at whatever level they are, whenever their parents come to us with that question or they themselves come to us with that question, then we want these objective tests. We do a full neurologic exam and, we'd seen Sofia before, so we knew what her baseline was. And then once we have all that information, we sit down together and we say, hey, look, this is what the data looks like. There are some clear-cut times that we would say, probably best if you retire. So one, she mentioned already, I think that her athletic trainer was noticing that her injuries were coming closer and closer together.
The injuries were coming closer and closer together?
Or that she was at least having one every season.
But yeah, I had one every season. Either it was like I would have one in fall and then it would take a little bit. Or if it was even just like a little knock to the head and I felt, which at the time we couldn't differentiate anything. We didn't really understand until I visited you that last time.
Right.
I'd get hit. I'd go for a header and I'd have light sensitivity, sound sensitivity, and a really bad headache.
Okay.
After the game. And then I was almost getting baseline tested or scat tested after every game just because I would have it wasn't every game, but pretty frequently throughout the season.
Frequently, right.
And we would establish based off then, like if I would play the next game, or I'd take a couple days off, let my symptoms calm down a little bit, and then go back. But we didn't treat it as
so iffy.
So that's like the lower threshold. So we talked about closer, so like increased frequency basically, but shorter duration. Then one is threshold. So if a lower threshold, which didn't used to cause concussion symptoms, was starting to cause concussion symptoms. She didn't used to have headaches every time
like
she went out
in
for a
high
headache.
school, right? In high school, you would do that, and it was fine, right?
Yeah.
Like you were heading and doing all sorts of stuff.
We didn't even think twice about it.
So that's another probably time when you would say, maybe time to hang up the cleats.
Right.
And then a third. So those were two. Third, if we saw anything on the objective testing that we got, so anything on MRI or anything in the neurocognitive testing. And then if it's taking longer for her to get better in between, or a patient to get better.
Hey, if you enjoyed that clip, check out the full episode on our YouTube channel. Don't forget to subscribe. Don't forget to follow us on social media. And most importantly, stay safe and be well. Thanks.